Which leads us to the Herald Sun. Caleb, your paper tomorrow, it's got two really interesting yarns on the front. And I guess probably the most worrying is the splash newborn alarm. Thousands of new mothers and their babies across Melbourne's booming outer west are missing out on vital health checks due to crippling shortages of specialist nurses. Again, Caleb, I feel it's every day at this point in time we're seeing a story on the front of either the Herald Sun or the Australian with the fact that the health crisis in Victoria, it feels like there's no genre untouched. I mean, if it's not cancer nurses, it's specialist nurses in midwifery.
Well, look, if I had $1 for every time I've had to discuss a health crisis story on this program and other programs on Sky News, I wouldn't have to come on Sky News anymore because I could just retire and not worry about anything. And that is really worrying. That is really worrying. And look, I've made this point before, but I'm going to make it again. Daniel Andrews has had some influence over health in this state of Victoria for a very long time. Before he was Premier, he was Health Minister. He has presided over one of the worst, you would have to say, one of the worst health systems in the country, if not the worst. And I know we talk about problems in South Australia and Queensland and New South Wales. There is no state that is without health problems, but we are in the grips of a serious crisis down here in Victoria. And if Daniel Andrews is not held to account for this and he does not pay for it at the ballot box in November, it will send a message that he can get away with anything. He can get away with lockdowns and he can get away with a health system that is not fit for purpose. We live in a first world country, and in a first world country we should not be telling new and expectant mothers that they have to skip on important appointments because we do not have enough midwives or doctors to see them. It is a dead set disgrace.
Yeah, and especially at least because it's out in the outer suburbs. If you think this happened in somewhere like Toorak or closer to the CBD, there'd be absolute outroar and it would be fixed ASAP. But that also, this is not an issue that is just sort of isolated to Victoria, even though it is incredibly acute at this point in time. But as we've seen, you know, your Treasurer, Cameron Dick, holding private talks with all of the energy companies because saying we need more cash to fund our hospitals and things like that. It just goes to show if you don't put health front of mind, I know it's always the biggest chunk of a state budget, but surely, if sustainable health systems are not one of the roots of all of the best things that we can see in this country, then we're absolutely cooked.
Yeah, well, you have them out there. Look at the fight we had to get the Adani coal mine approved, and now they're going cap in hand to the coal companies and saying, well, you know, we need more of the royalties because, yes, the health crisis, like in Victoria, is in crisis. The health hospital, the health system is in crisis. And, for example, tonight on the news, they were saying that the children's hospital, the major children's hospital here in Brisbane, would average around up to 200 children a day. They're now over 300 a day. They can't cope with the number of children they have. You've got the AMA now calling for more funding in the budget that's coming up for another 1,500 beds at least. Like, we have 42% hospital ramping. It's one thing the opposition is out there nearly every day saying that this needs to be addressed, but that doesn't help the poor people who are stuck on those ambulance stretchers that are being ramped because there are no beds, or the parents that are sitting in waiting rooms in the children's hospitals. It's not good enough. And when you talk about Victoria, there was a horrendous story a few weeks ago where there was a lift in one of the hospitals that wasn't working for weeks on end. And there was, I believe she was a pregnant woman who was on a stretcher having to be carried downstairs. What is going on?
Yeah, it's not just not good enough. And anyone that can crack it, then good luck to you. You probably have my vote for life.